This is project implementation phase 3, step 2, workflow changes. HIMS 670 9040 Health Informatics Administration Capstone. Dr. Goodwin Odia, instructor. The agenda is going to be the background, purpose, approach. We're going to highlight the current and future states of storage and consultations, assigning patient exam rooms, sending messages, send prescriptions to pharmacies electronically, keeping track of health information, entry time stamps in EHR. There were 3 phases to this implementation. Phase 1 was initiation and planning, phase 2 the execution and closing, and phase 3 is the change management. In HIMS 650, we completed phase 1 initiated and planning. We delivered the description of an existing paper-based medical record system. We identified the stakeholders, project team, and project manager. We developed a EHR implementation plan. We planned for the resource requirements, human resources, finance, and project management software. Then we looked at change management plan. In HIMS 661, we completed phase 2 of the execution and closing of the project and delivered the work breakdown structures, the system acquisition, including RFIs and RFPs, provided the EHR implementation schedule using a Gantt, outlined a communication plan with the stakeholders and team members, laid out the monitor and controlling with scope, tree, time, task, budget, and quality, outlined and executed the testing, the unit and integrated performance system testing, and then the closing and signing off of the project completion. And we're here at HIMS 670, and we're developing phase 3, the change management plan. It's a 6-step process, and we're to consult with relevant resources for each step and guidance. The purpose is to discuss the second of 6 post-implementation steps highlighting workflow changes, its current and future state. This includes storage and consultation, paper-based medical record versus a digital health record, EHRs anywhere, anytime, scheduling and checking the patient, sending messages via emails, text messages, and patient portals, refill medications, patient portals, sending prescriptions electronically, and keeping track of health information using the date timestamps. According to the National Learning Consortium, adopting electronic health record EHR will change the flow of patients through the organization. So workflow redesign is a critical step. It maximizes efficiencies, enhances healthcare quality and safety, removes the chaos from the current workflow, and improves care coordination. Our approach is going to involve workflow mapping. According to Stausberg, workflow mapping is used as a blueprint to discuss changes for the future and to implement new processes. We're going to look at paper-based medical records, determine the boundaries and who the stakeholders or customers are for these processes. Then we're going to go ahead and transform, and we're going to map out the as-is process and also analyze the as-is process. And then we're going to create the to-be process, which is going to be the digital health record in EHR from anywhere and anytime. First area you're going to look at is storage and consultation of the paper-based medical records. And we're going to kind of look at the pros and cons. So we'll start off with the cons. The storage isn't scalable. Lack of backups for limited security. Time-consuming, error-prone, and a loss of data integrity. Inconsistent layouts, and there's really no audit trail for version history. The pros are the reduced upfront cost, ease of use in the familiar format, a physical form factor paper, and easier to customize. Next, we're going to look at the advantages of digital health records in EHR. It's far more secure and not at risk during a catastrophic event. It's easier to retain accountability where each entry log is consistent with a specified user. Easier to keep track of those diagnosing patients, recommending medical outcomes, and it allows customizable formats, helps things with legibility and accuracy of medical data. The next area is schedule and check-in patients. This is a very exciting area. I ended up looking at a lot of product offerings and built up the best of features available in those areas. Pretty much broken down into scheduling, automatic check-in, and then check-in for patients. Now the scheduling we want to talk about, want to look at, they have lots of features. It provides daily and weekly and monthly views for exam rooms and patients. Scheduling looks at the patient's schedules by office's location and or by providers. It handles automatic appointment reminders by phone, text, or email, and then one-click access to the patient's health records. It also includes driving directions to the provider's location. It can provide recurring appointments for patients who have a schedule. In addition, it generates all the information, including letters to patients who miss their appointments, authorization for tracking of management, and then online eligibility and insurance verification. The next schedule and check-in patients area is automatic check-in. By using automatic check-in, it increases revenues by collecting co-pays, obtains digital pictures, improving the patient safety and fraud, links to billing module to make the encounters that are not overlooked, allows doctors to communicate important tasks that should take place before the patient leaves, provides intermittent updates of the patient's appointment status, relaying waiting times and the patient's location office. Also allows a patient tracking to check in and check out procedures that all required documents are available, including insurance, billing, payments, visit notes, prescriptions, letters, and follow-up appointments are complete. The last area for checking, schedule and check-in for patients discussion is the actual check-in patients processes. Like the automatic check-in, it increases copay collections through the billing module, reduces fraud and increases safety with digital folders, very much like the automatic check-in. It gets the billing notifications so staff knows about unpaid bills before the patient leaves, improves the inter-office communication, prints automated letters as patients check in and out, processes insurance cards that are scanned, as an example through a small card scanner. They also provide areas like check-in kiosks that allow patients to check in themselves just using an ID card or using their iPad or tablet as a touchscreen. The next area you want to look at is sending messages using EHR. There's Patient Healthcare Portal, and that's allowed patients and healthcare providers to communicate effectively. There's sending messages with electronic prescriptions, notifications sent to iPhone or any device, as well as through any method, including emails and texts. There's automatic follow-up reminders, where automatic notifications sent to the iPhone device or Android device via email or text. It ensures patients receive the appropriate tests, immunizations, exams, screenings, and other educational material. The last item is provider alerts for reminders. And it sends reminders to staff members to call patients who require follow-up visits. Also, the reminder alerts healthcare staff for critical staffs that should be resolved before the patient sees the doctor. The next area we want to look at is send prescriptions to pharmacies electronically. And what we want to talk about here is just talk about the different types of dimensions, the focus areas, and the potential benefits. Now, as you can see here, we have the multiple dimensions with the analysis design. And if we look at the dimensions, there's increased timeliness, ease of use, accurate prescriptions, and compliance. Now, for increased timeliness, there's electronic transmitting and increases the medication pickup rate. For easy use, electronic prior authorizations is employed, and it sends pre-e-prescriptions via iPhone and Android devices. The other dimension to look at is the accurate prescriptions. This is done in the focus area is electronically prescribe controlled substances, and the benefit is increased safety with allergy and drug interaction checks and notifications. The last area is the compliance, and it tracks medication and refill histories, and increases safety and dosing. So overall, the EHR system integrates either its own module or into another vendor's prescription module that is linked to the pharmacy. The last area to discuss is keeping and tracking health information, entry timestamps in EHR. This is important as it improves clinical workflows, where organizations can use the EHR timestamp for improving workflows by approximating the time it takes to completing common tasks. It also improves access to quality of care. It increases timely access to quality care by patient satisfaction, and value-based reimbursement models reward clinicians. The other item is improves patient satisfaction. Existing EHR timestamps can help organizations boost physician productivity and increase patient satisfaction. According to Kent, over 84% of the EHR calculated exam times were within 3 minutes of the observed times, indicating that this method or data set could offer providers an alternate substitute for manual observation or estimations. Thank you for listening to my project implementation phase 3 step 2 workflow changes presentation. After this, there'll be 10 seconds of the references. Thanks.